have with it is the idea that, and I know you talked a little bit about it as well, is the idea that basically with AI, it can't interact with you. It doesn't really know you, so it can't respond in a certain way that other people will. But I think people kind of misinterpret what AI should be doing, because there's a lot, especially with like, I mean, depending on where you are in the world, what's the wait time to actually speak to a mental health professional? Like, there's everyone can say that there's no wait time, but we know there is. Like, to actually physically speak to a person, and if AI has got to the generation at which it can at least just talk to you in, even if it's a name bullshit, because that's half the time is what people actually need when they're going through a crisis. It's not actually words of endearment. It's not necessarily words of encouragement. It's just someone else there going, God, today's been shit, hasn't it? Oh yeah, weather. Oh mate, yeah. And not trying to tell you everything's going to be all right. If we can get AI to just be a kind of conversational replacement in parts, that's part of its job as mental health. I think people, when you look at AI and mental health, which I've seen some people talk about on other channels and things like, and like in the news, they look at it only as a surgical and clinical tool. Whereas I think the idea of having it just there and kind of almost being a friend, if it can be a good enough level, which it's not at the moment, then I think that actually helps anyway. I mean, how many people suffer in loneliness in the world? How many people, you know, that just can't reach out to someone because they just don't know how or whatever? It's one of those things.
All right. So, I think for, having access to just somebody to talk to, I think that is absolutely huge. And I think that sometimes people overestimate how much they specifically matter in a situation versus like just having somebody or something there. And as you said, like in time of crisis, it's mostly delay until it's over. Like keep them talking, keep them going. It's not a matter of like, we're going to fix this problem while you're in crisis. Like you don't fix anything while there's a crisis going on.
No.
All you can do is kind of wait it out and help them get past that. And then I think, on not just the idea of like access, to somebody immediately or whatever. I mean, let's look at cost. Obviously in the US, and that is where everything is charged out the ass for healthcare, because it's incredibly inefficiently run. And mental health care is one that's usually not included. Or if it is, it's like super limited. And then you got to find someone in network. And, like, at what point do people just say, fuck it, it's not worth it? And I say that as someone who's been like, okay, it would be probably great to like have a therapist, but that's just a lot to like put on my plate, and it's like, well, I don't want to deal with that. That's one of the things, like, trying to find a therapist, the whole point is like, I feel like I've got a lot to deal with, and so by piling on extra stuff, it's kind of against the point.
Well, yeah, I mean, and actually, even with the cost, I mean, even in the UK, there's not so much of a cost thing, but like you can access some help, but it's a standard with the NHS that it's CBT. So there is some form of therapy, but it's not actually useful to everyone. Like for some people, it's fantastic. It should be what is there. But for some people with more complex interactions, CPTSD, for instance, CBT isn't going to help. Like, unless you've really gone to a lot of other things already and are already on that massive road to some kind of solace, CBT isn't going to be helpful to you. So for things like that, in finding a therapist, you can almost use it as a kind of, these are kind of other things. These are little snippets to add in with everything else, and not necessarily. So in terms of cost, it can be a kind of a nice little add-on, just as something, so you don't have to go and find an incredibly expensive, although private psychiatrists aren't as expensive here, but if you're going private to find one because the one that's offered on the NHS isn't right for you, then it's going to be a cost that maybe you can't afford. So it's definitely needed. And you're definitely right with the it's not a case that you can just fix things. Like you say, it isn't. I know a lot of people want to, and I know so many people just want to go, but I can fix it. We can figure something out. And you're like, no, you can't. And I mean, this is why when I was a streamer, I used to have a Wednesday check-in, and the main reason was it was, hey guys, come in. There's no judgment. Come in, scream, shout, let everything out. Like, this video will be deleted. No one's going to see it, but you get to just scream without somebody going, we can figure this out. We can chat back and forth, and there was always something there, but it was without the need for trying to fix someone, because that's the biggest problem. A lot of the time, all we really need is someone to listen, because it's a validation that whatever we're screaming and chatting about is real, rather than just going, hey, I can fix it, because that also seems really patronizing when a lot of people do it. And people don't realize it's patronizing, but when somebody is coming to you going, I'm in absolute hell, and your first response is, I can fix this, it's like, wait a minute, what the fuck? What do you think I've been doing? What do you think? Like, it's as if it feels like you haven't been trying, or they think you haven't been trying. And it's kind of really, it can be really difficult for a lot of people. So you're right, that just being there is great. And the cost as well. The two together are definitely part of it. I mean, I did a podcast a while ago where I basically interviewed ChatGPT. And it did ChatGPT, and it's wonderful, but it's not actually that higher level AI. It's just a language model. People out there, it's not that high. Chill out. It's like it obviously didn't have massively complex responses. So I think the one thing that we might come across is we'd have to be very specific on the type of AI that it's meant to be. It would have to be, rather than people like ChatGPT, copy AI, everything else, people will try and use it for stuff it's not actually meant for. Whereas we need to be, look, this is a mental, this is a therapeutic tool. So this version of, whatever we're going to call it, AI therapy, AI friend, whatever, it's like, this is a therapeutic tool, or this site is a therapeutic tool, and there are 3 or 4 different options within it of what you need. You need a friend, you need a therapist, whatever, so that people go to the right type of AI, because otherwise it feels like people might just go to ChatGPT. They might go to copy AI and be like, hey, I'm depressed, what the hell do I do? And it's not going to have an answer. It's a bit like in real life, instead of trying to find a therapist, you just go to the guy at McDonald's and say, hey, I'm depressed, help. That's not for that.
Right. And I think that's a great point. It's like, as soon as you, like, whenever you're interacting with kind of that basic model, at its most basic level, it is the equivalent of talking to a random person and asking questions.
Yeah.
You can tell it more specifically what kind of person it is, and just by doing that, you can greatly improve the quality of responses. Like, and like, when I saw somebody actually messing around with kind of a rather in-depth prompt of, giving it that kind of the context of having access to all of these, like, behavioral tools and mental frameworks and everything like that, and really putting it in the context. And so you can do a lot of it with prompting. But even then, like, doing an extra level of fine tuning, and OpenAI just came out with kind of their announcement that they're going to allow fine tuning on the GPT 3.5 model, which I think is going to be really exciting. And so, yeah, like, these models just in general aren't that great, but you can really, like, key them into specific things. And, I think one of the things that this will probably help too is giving people the ability to kind of, like, try before you buy or switch things out. Because, as you were saying with kind of the, you've got, these the CBT trained therapists in the UK, which is great if that works for you, but it doesn't work for everybody or all situations. And so just having the ability to figure out, like, what kind of person you work the best with, and then going to that professional specifically to, like, get that human interaction, like, I think that's huge. And I think people see it a lot as, like, either or, when ultimately it's going to come down to kind of a combination of human AI, really providing kind of that comprehensive experience, and helping direct people to the right uh, types of professionals that can help them, and really helping them come in with context. Like if you have this interaction history with a chatbot, and then you can take that and give that to the therapist, and they have this context of all of the stuff that happened while they weren't there. um, it's like, oh, well, now instead of spending 45 minutes of your hour kind of going into the details about your life have impacted you, it's like you have this entire chat history that then you provide them, and they're just like, actually they probably even have the AI summarize it for them,
Yeah.
and say like, hey, ask about this, key in on this, um, and all of a sudden that really opens up new ways of interacting with patients. Not to mention, you could probably use it to scale the amount of people you can help, because if you can get rid of all of that extraneous kind of conversation and figuring out what's going on, maybe instead of an hour, it comes down to a half an hour, or
As well.
every so often. Like it doesn't need to happen all the time.
Yeah.
And I think it can really, be used that way, much more efficiently, and just easier for everybody involved.
Yeah, I mean, and like I say, because you're taking all that out, you're bringing the price down for everyone again. It's so even outside of everything else we've already said, by the fact that you're making it a quicker process, you're making it cheaper for everyone. You get away from all the, because I mean, the first thing you will hear from anybody, if you say to them, "Hey, have you been to therapy or whatever?" People go, "Oh yeah, I know. It's about my parents. It's about my childhood," because that's what we've been taught to think. And if you just go, "Hey, look, actually, you can just give this to your therapist and bypass any of that preconception you already had," it does really help that. I also think it can be good the other way. So almost like a little kind of packet of who your therapist is, or who your best friend is, or whatever like that. And that's a bit like you would do with chat prompts of like, if I'm this person or if I'm this, can you help? Have those that work into whatever AI structure you're creating, so that it feels like you're talking to someone of a certain age, of a certain cultural background. For instance, I'm probably going to feel a lot better talking to someone from my part of the world, because they understand similar things in medicine that I might have come across. They might understand similar ways. For instance, we don't, although it's technically built in, we don't theoretically use the DSM-5. So the literal way in which we diagnose someone could be different. So if you have that ability to pack it in, hey, well, this is the packet for south of England, middle class white guy. Like let's go for the fucking that one, that generic fucking Lego brick person. Let's go for that one. Then great, we can go for that. And if you're from, if you're a Danish Greenlander, and you're part of an Inuit tribe, because I think 83% of Greenlanders are Inuit ethnicity. They're who don't have for instance, don't use cars because they don't have roads, they don't have train tracks. Just simple things. If you have a packet that just goes that one, then it's going to talk to them in a very different way. Because, for instance, some part of a daily commute might be built into whatever you're chatting about. A very British thing to chat about would be a daily commute, would be the weather and things like that. So that bullshit bit at the beginning where you're just chatting about, like, I just need to complain about stuff, that's bypassed if that's not in your little packet that you've pressed on, because, well, I know that in Greenland there aren't any fucking train tracks, so why would we talk about that? It just takes out. It seems so simple a lot of the time, but it's when I've spoken to people, especially in America, especially when I was streaming, the biggest thing I always used to point out is that when we talk about mental health specifically, it's so important to remember that even though to a point we sound the same, our interaction with how we look at things, how we understand things, are completely different. For instance, having a therapist in America is a normal, healthy thing. Having a therapist in England is seen as weird as fuck. It is not a normal thing for us. It is absolutely not a normal thing. It is something that if you told someone, they would go, well, what's wrong? Not, oh, you're making yourself better, it's a continuing process. No, there's something wrong right now. So that context as well, if again you have that little packet that says, you know, English cultural background, this side of it, you know, it's going to allow people to have that, you know, because otherwise it's a bit like when you go to, like, so many people out there, I'm sure, have gone to a therapist or given up on therapy because they've gone to maybe 2 or 3 therapists and they've been the completely just wrong person for them. And if you can take away some of that bullshit, I think it can really help get through that, because there's so many people out there that probably would benefit from therapy that don't have therapy because they spoke to the wrong person. And even though there's 20,000 therapists out there in a specific area, you've seen 3 and your mind just tells you that's all there is.
Yeah, I think that's kind of an interesting point too that I want to pick out a little, because yeah, I think everybody assumes that like all therapists are top notch, right? Like they all have this equal quality of like they're all the best.
Yeah.
When the reality is, in therapy, for a therapist or for really any profession, there's a wide variance,
Yeah.
right? For every therapist that graduated at the top of their class, some of them graduated at the bottom of their class.
Yeah.
And so the one thing that I think AI does really well is it elevates the floor, because it gives everybody kind of a baseline of competence. You're still going to have variation, but it's not going to be as bad as the worst human. And so I think, if you can bring that up, the nice thing too is that when you do it at a cost, all of a sudden it becomes accessible to people who normally wouldn't have that. And one of the things that I see, a lot when talking about bringing AI into medicine or anything like that, it's like, oh, well, it's like, it'll never be as good as a doctor. It's like, okay, what about the villages in Africa where they can't get a doctor? But maybe they can have access to an AI system that can at least help them part of the way, or help the one traveling doctor in the area, help support them to be able to, provide assistance to these areas. And so I think there's a lot of potential there in scaling it outside of what people even consider in their arguments against AI. Because, even if an AI doctor isn't particularly good, it's probably better than no doctor.
Yes.
Or, and that's, everybody's comparing it against like an actual, person. And in reality, these AIs are going to come into play the most where people don't have access to people. Because I think for the majority of humans, they do appreciate having kind of an individual person that they can work with in situations. But for a lot of people, that's just not reality. And I kind of look at it in terms of what rich people have access to now. There's a good chance that, middle and lower class people are going to have access to something similar at some point in the future. And that's been going down over time. But if you look at like what, rich people have access to, it's things like, private chefs, personal trainers, all of these like really individualistic services that most people don't have access to. But with AI, some of these things can come in. Like, potentially you could have an AI chef that knows what you like and can, possibly cook stuff up. But if not, maybe even just produce a meal plan for you based on what you have in your refrigerator, and can tell you specifically what you need to do. It can help you monitor portions. It can suggest exercise for you. There's a lot of that stuff that can come out of AI. Again, I don't think people tend to think of things that way, but when I look at it, that's what I'm looking at down the line. It's like, okay, what do people have access to for lots of money now that we could reduce costs for later to where everybody could have them? Because I think these level of individual attention in kind of every aspect of our life is ultimately what's going to be needed, because life is getting more complex, right? It's not like every day you're waking up, you're working on the farm. It's a slow process. It's like there's constantly being, new information coming out. There's information warfare at play. There's just a lot to keep track of. And instead of doing it on a what's happening on my farm right outside my door, it's like what's happening all over the world at all times, and how does that affect me? In reality, it doesn't mostly, but it feels like it does, and that's something that we have to learn how to figure out, because I think that's leading to a lot of the mental health issues we're seeing right now.
Yeah, and I mean, you made a point there about a private chef and things like that. It is interesting that people don't want to trust AI for certain things, but at the same time actually kind of do. But it's not even AI. So think about how many people enjoy Magnum ice creams. That's not one person with a stick putting it in ice cream then putting it in chocolate. That's machines with pre-programmed jobs that are doing it. That's not that's literally machines that are doing that. But you trust it that you're not going to get poisoned by a Magnum, or you're not going to get some kind of problem from all of those things that are done by mass machines. We already trust that, but when then
Because we don't see it.
we don't see it, and it's when we give it a name. But it's also, and I think again, it's this idea that I think AI has, and I think a lot of the worry that people have at AI as well is because people have only seen language models. They haven't seen the in depth thing that Chat GPT, Copy AI, all those are not what AI can be and can do. Because people always go, because you'll always get people go, oh yes, but obviously AI makes mistakes. Yes, it does, like everything else. But if you've been asking a language model to do a specific medical breakdown of something, no, it can't fucking give you the answer, because all it's doing is it scrapes the web for specific answers and mixed it together. So occasionally it's going to also scrape that one research thing that didn't have a good background to it. The hypothesis was crap and it had no real peer review, and it will throw it into the mix as well. And then people go, oh, look, it's done it wrong, and so we shouldn't trust it. And you're like, no, we shouldn't trust a language model to be a doctor. That's what we shouldn't trust, but that's not what we would do. An AI specific, a medical AI, a psychological AI will be used for those things. I think that's the thing that a lot of people bypass is you hear AI and that's where people think. That's what they go for. It's that thing that can write essays for me or whatever, and therefore it can do everything. That idiot that went on Joe Rogan and said, well, I replaced my lawyer with AI because I asked them both a question and AI sounded similar. And I'm like, yeah, great, but that AI isn't keeping up to date with every single thing because it scraped the web beforehand to give you some kind of answer. Whereas your fucking lawyer actually goes into the office every day, the same as if you had a specific law interaction with an AI that is built for that has the interactions, that has those case files. It is constant. It keeps up to date. It is it's built for purpose, and that's the thing that we bypass. Like you say, a lot of people are like, oh, this AI is never going to be as good as this doctor. It's possibly going to be better than some doctors. Now, don't get me wrong, depending on what kind of surgery I might need, there's going to be part of me that goes, I don't know, because that's human nature. But I think a lot of the time when we only allow ourselves to think of one step at a time, which is what the way AI has kind of hit everyone, we've only kind of gone, it's this approach. That's hurt our way of looking at continued technology. And we seem to be falling down a lot because we aren't understanding that.
Well, I will say, the guy who replaced his lawyer with an AI, based on the level of research he put into that, there's probably a decent chance that it's just as good as whatever lawyer he happened to pick out of the phone book. And
yeah.
and then so it's going to be like the level of diligence you put into selecting anything is going to have a big bearing on the level of outcome that you receive. And so if you do just select whoever happens to come up because they're all the best, and this is why I always think that anytime you're optimizing for cost, you've already lost. Like, because going with the cheapest is not the way to win, and selling at the cheapest I think is also the worst way to go, because anytime you're dealing with people, and this is something I've found from being around entrepreneurs, are like, it's so much easier to work with like the person who's got like the $500,000 contract versus the like $50 contract. Like the person who pays $50, they want everything, they want immediate service, like they don't actually understand everything that goes into it. Whereas if someone's paying $500,000 for something, they're paying so that they don't have to worry about it and they can just let you handle it. And, it's like great. that's something I don't have to worry about now. I'm not going to pay attention to that. Like, I'm paying you this because I trust you to do what needs done. And so I think that kind of thing really comes into play here. And it's like, so anytime you know, trying to figure out like necessarily like the cheapest way to do things, you're probably not going to do great with it. But with AI, you can make the cheapest at least more effective, right? And then so that kind of raises the quality for everyone, because the people that are at the top are going to use AI the most effectively and figure out how to use it to maximal effect. Whereas the average person is going to just pick whatever that happens to get the best marketing. And there's going to be variations there, but yeah, I think it'll make it a lot cheaper to potentially switch, to kind of figure out the one that works the best. And I think with AI, it's more verifiable. Like, there's a lot of things that, and that sounds weird because most people complain about the fact that you can't really see like how an AI makes decisions and whatnot. But I think we're going to get to a point where it's more tied into the data that it's like creating, right? And so as the AI makes decisions, it can then check itself against future outcomes and say, oh, well, based on this, I did this, but this was a negative outcome. So next time I'm going, and so you're going to see that change over time, and it's going to improve itself. Whereas, with people, there's a lot of ego that gets in the way of that. It's like, oh, well, I screwed up this time, but it's not really my fault. It's this other completely different thing that, affected it. And so I'm going to do the same thing next time. And because that's just how I do it. And I'm set into my ways because that's how I learned to do it. And nothing will ever get better. Like, that is the best.
Yeah. The definition of insanity, doing the same thing over and over again and expecting a different result. And it's
right.
And with that as well, you do get people that will be like, well, I wouldn't do that the way that an AI would, and or whatever. And you're like, actually, you would. You just don't want to admit that you would. So the one that immediately comes to me, because it's used a lot and it was used in a film, is from iRobot, is the idea of saving the younger person over the older person, or the person that's most likely to survive over anybody else. And then we'll go, but that's just wrong. And when you see it on newspapers, I think when it first came out, that a Tesla would if it had the choice, it would take out the media immediately. AI cars look to kill old people, and you're like, no. But let's go to the military and their triage and ask them what happens when they're presented with two people, one of them's going to survive or not. Do they take both of them? No, they don't.
Go to a hospital.
They can't.
They have triage.
Yeah, exactly. Just normal triage. But
like,
I'm thinking of things when it's like really, any kind of triage, you deal with the person that's actually because triage in hospitals will deal with the person that's most ill. But triage with on the battlefield will more likely treat the person that's going to survive. And they might not want to admit this, but that's what they do. We do things in that manner. We just don't say it as straight down the line, which is also kind of definitely coming back to the mental health thing, because it's also the reason that neurotypicals don't like a lot of neurodivergent way of thinking, because neurodivergent are more likely to just tell you the exact way it's going to happen, and people don't like to think that they think that way, even though they do.
That is it, and it is funny. Like, people have a really hard time understanding that they are essentially computers, but they're computers running software that has evolved over the course of millennia. And a lot of it's outdated software. And so, that has some kind of funny effects, because it's like we haven't been properly patched to understand what actually constitutes a threat now, because it's probably not a tiger anymore, right? And so, but we evolved to kind of err on the side of caution, in the sense that, if that rustling in the bushes is a tiger, and you think it's a tiger, and so you run away, you survive, great. If you think it's a tiger and it's not a tiger and you run away, great, you still survived. You're out nothing.
Yeah.
Whereas if you're like, it's probably not a tiger, and it is a tiger, you're dead. And so, like, the fact that that one has a a dead outcome, the whole genetic process kind of evolved that out, because it's like there were serious consequences for being wrong, and so we err on the side of caution. And so much of what we're trying to do, in terms of like personal growth and kind of personal really evolution, personal upgrading our software, we need to learn where the stuff that we think isn't aligned with reality, and figure out how we can have the tools to move ourselves forward.
Mm.
And I think so much of that is something that like AI can help us with. And this is kind of the coaching chatbot that I'm working on, because it does kind of tie into that. And it's like, okay, so I don't think most people need as much help as they think they do.
Mm.
But one of the things that I found really helpful, and kind of I think it's what coaching really gets into at its core, is asking the right questions to get the person thinking about things a little differently. And it's just like that small prompting, and making them ask questions that they didn't think about. That's a great way to overcome some of this programming, because it's like so much of it is so programmed in so deeply that we never think to question it.
Mm.
And so it's the fact when someone can look at you and say, okay, well, let's step back, and why did you do that? Like, what were you thinking? Walk me through that process. And like, did you consider this? And it's like, oh no, I didn't. Like, that never once crossed my mind. And that's, I think, where these chatbots can come in and just ask questions. They don't need to tell us anything. They just need to ask questions that we can answer, and get that conversation moving.
Yeah.
And I think that's one of the areas that people don't give enough credit to, just asking questions. And it's like, when you're surrounding yourself with friends, they're probably not asking you those questions, because sometimes it's weird and uncomfortable, and we don't like that. So it's like, we just discuss the happy stuff and the easy stuff, and we don't ask about any of that because it's hard. The
Yeah.
AI doesn't care. It'll be like, hey, great. So how are you feeling? What went on? What sucks? Like, let's talk about it,
Yeah.
because I'll talk about anything.
Yeah, I mean, it's like, because again, when I was streaming, the thing I used to say was, because there were certain words that I banned. So I banned the word fine in chat. If I asked you how you were, you weren't allowed to say you were fine, because fine doesn't mean anything. Fine's what you say when you need someone to not ask you that question. Whereas, and that can make it uncomfortable because it's from another human being, and you can then go, oh, I feel like I'm in the headlights now. Whereas if it's AI is just going, no, that's not a word that is programmed into how I use it. I want to know who actually. Let's have an actual discussion, and it just bypasses all of the simplistic bullshit. It does, because it doesn't have, basically AI. Basically, AI has a lot of autistic traits that are helpful, because it just kind of goes,
Right.
that socialized way of looking at things, that can fuck off. That's not actually useful to us right now. And there will be people that always push back against that, because in the same way they push back against anyone that's neurodivergent, because it's uncomfortable. But at the same time, if that is the way that we kind of know it's going to do it, and we have that start to become the norm, then again, we just go, okay, this is the way it is. I've got to, and actually, ironically, that would then help mental health in general with neurodivergent people who can't see those social cues. And so the way that AI is treating people will help people actually understand more about neurodivergent people that don't know their normal social cues. It will actually bring a greater in-depth for a lot of other people as well, by accident, because both of us neurodivergent, and we don't pick up on the same social cues for people. So it's we will get seen in weird ways. And it's quite funny, because I remember when I've written, I wrote some stuff for someone, and they immediately just went, have you used ChatGPT for this? And I was like, no, run it. And they ran it, and they just went, oh, it's zero. I'm like, yeah, I just naturally apparently sound like an AI. I apparently write somewhat robotically. Fantastic, because it's just how I structure things. I remember talking to someone about how like I had an interaction with my mother, and I was texting her, and in the conversation I had, I was talking about the fact that a problem that was emerging was like the sword of Damocles continually over my head, and it was just like, who the fuck talks like that? I do.
I do. Yeah, no, yeah, I've had similar experiences with that, and I think, um, that's probably going to be a lot of autistic folks going like, "Hey, wait a minute! Like, why are you flagging me as using AI here?" Um, which again, I think the universities like cracking down on that is dumb and short sighted. And
Need to learn how to
again,
teach.
um, but so something that popped into my head while you were talking there, and like about not catching social cues and everything. Um, what happens when we accidentally give AIs trauma? And trauma in this case, I'm using so when the AI does something that is actually good for us, but we react negatively, and so it picks up on the fact that it shouldn't do that anymore. And so as we have these language models kind of teaching themselves based on interactions, I am kind of wondering if we get to a point where either the AIs will avoid certain topics because of negative reactions they've had in the past when working with people. And are they going to do it either like in a way that is like unknown to them, or is it going to be something that they start doing intentionally while knowing that it's bad, but that the humans will rate it as good? And so like this is one of those weird things that we get into as we talk about potentially like superhuman intelligences, right, that end up controlling things. It does make you wonder if they're going to get to a point where they just like placate the noisy humans to make it easier and then just go do whatever anyway.
I mean,
um
yeah, I think part of it is actually going to be that they'll almost. I think they might end up doing what normal therapists do, which is basically use each other as their own therapy, and in a way of like, in a similar way of going, well, this shouldn't work here, this can work here, this shouldn't work there, and kind of going through the permutations to then kind of understand that the same responses don't happen for everybody, and then that becomes part of the way they interact with someone that has the exact same breakdown in trauma or something as somebody else. So it becomes they recognize things in someone's trauma, in someone's um, neurodivergence that most therapists wouldn't actually see or understand, because you can't memorize and take in that amount of information, but they can. And because they've each talked into each other, effectively been each other's therapists, kind of, they will then see those patterns, and it just becomes pattern recognition rather than. I don't have a fear of some kind of overall, being that just kind of goes, well, actually, the best way of helping mankind is by locking you all up. I don't personally worry about it or see it, because I think we over egg the pudding a lot in terms of what AI can actually do, or even how it interacts. Because what we do is the same thing that happens so often. It's what so many people have said about aliens and stuff. Because what we do is we started to anthropomorphize the understanding and ideas of it, and basically going, it's going to do this because that's what I do. And again, it kind of brings us back to that mental health neurodivergent thing, because that's literally the reason that neurodivergent and neurotypicals have such a big problem a lot of the time, is because the interaction that you have with someone, a neurodivergent will do something, but a neurotypical will take it as them being mean or manipulative, or just ignorant or whatever, because that's what they would mean in that situation, because that's how their brain works. But it's not how neurodivergent persons work. In the same way with AI modeling, we are putting a version of our own head of going, well, we would destroy everything because in our minds that makes sense for us. And you can go, yeah, but that doesn't make sense for something else. Like, that's not how that would think. And depending on the idea of thought and consciousness anyway, it's not really thinking.
That's actually a good point too. And this is something that I was kind of running as like a thought experiment. Um, and we kind of assume that aliens would be, there's always like the potential for like alien conquest and everything like that. Um, but one of the things I was kind of thinking about is kind of with the fact that the universe is infinite. And if you get to a level of technology where you can kind of travel to anywhere in the universe, you have access to unlimited resources. And as we've looked, it's not like a densely populated universe. It kind of seems to me like the optimal solution is cooperation among everybody to help everyone and just maximize the survival of everybody. Because the thing is, like, anytime you engage in warfare, like, there's a chance you lose. And even if you're advanced civilization versus not so advanced, I kind of feel like any sufficiently advanced civilization would get to a point where warfare just didn't make any sense. And the only reason that we think aliens would do that is because that's how humans evolved, and like we're kind of constantly fighting over what were scarce resources. But if you have access to a universe of resource, kind of this post scarcity economy, all of a sudden conflict really doesn't make any sense. The cooperation is the only play that, from like a game theory perspective, like everybody wins. Like that's the ultimate outcome. And so anything where somebody loses is automatically suboptimal and doesn't make any sense. I kind of think that's where AIs would end up as well, because it's not a matter of necessarily like competing for resources, um, unless humans threaten the AIs. I could potentially, but even then, I don't know. But yeah, it is funny how we do just everything ends up being human in the end in our eyes, because that's all we can understand, because it's really hard to imagine the viewpoint of any other species.
Yeah, which again is why it becomes such an issue with neurodivergent neurotypicals, because it's the same kind of pattern, really. Not to say that either side is not human, but it's that kind of thing. If you think a certain way, it is incredibly hard to not think that way, to understand what someone else is saying. It
Yeah.
becomes built on a trust, and actually, that again, going back to the idea of therapy and things, can be the really beneficial thing for a lot of neurodivergent specifically, because there'll be a way that people like us that are neurodivergent speak that a normal therapist, no matter how many years they've been doing it, may just not get, because it's theoretically possible, for instance, they've never actually dealt with a neurodivergent person. It's not likely, but it's possible. Just because you have a mental health issue doesn't mean you're neurodivergent. So that it's because you go through bouts of depression doesn't mean you're neurodivergent. You just go through bouts of depression. So that can be a possibility, or you might not have that much experience as a therapist to fully understand, because your way again of breaking down how someone's acting is to plug it into that kind of mindset of, well, this goes with this and this goes with this and this goes with this. Whereas a machine's not going to see that. It's going to go, okay, so these patterns in how that person's spoken, these patterns in how that's structured. Oh, this person's neurodivergent. Right, okay. Flip that switch in my programming. This is now how I deal with this person. And it doesn't need to then kind of understand a neurodivergent or be in a neurodivergent. It's ready for it. It can just change in that moment to actually really help one part of society that get frustrated with the other half because they're thinking the wrong things, and that part of society gets frustrated with this part because they don't understand those things, and it kind of placates that. It just moves through it.
And not even just like not understanding, but I think much more likely to a therapist, not seeing neurodivergent people, there's a much better chance, I think, of them pathologizing it and saying that's something that needs fixed, as opposed to it's different. Like, and you know, so trying to turn that person into someone who is neurotypical because that is the right way,
Yeah.
I think ends up creating a lot of harm.
Yeah. Absolutely.
um and you know, that's something that we could potentially avoid with an AI who's like, oh yeah, no, like I can, you know, switch the way that I think to match this so I can understand what they're talking about. And I think this is exactly what it comes into when we're talking about kind of this individualized you know, help in kind of everywhere, because it's like it has that entire context to understand what's going on in terms of like how you communicate. And so it's not just like what you're saying, it's how you communicate in addition to that. And it has so much more context that it can draw from, as opposed to a therapist that you see once a week in kind of therapy mode when it, you know, and I think, you know, we all have kind of that, like we have different ways of interacting with different people, right? And I think over time, like as you develop a relationship with a therapist and you're able to kind of go deeper, but it's not something that just happens immediately, I wouldn't think. It's something that you kind of have to really put a lot of time and effort into. But if you have something that you're just chatting with constantly, bouncing thoughts and ideas off of, using it as like an interactive journal type thing, all of that context is contained within that. um and it's not putting on the right mask for therapy so that you know, your therapist is proud of you or whatever. Like I, you know, I've seen people kind of talking about that. So um it is kind of funny that, you know, it's like the people who clean before their house cleaner comes over,
Yes.
because you don't want them to have a bad you know, think poorly of you, right?
Yeah.
And so I think that there is a lot of that it can get us away from some of these kind of weird um, social interactions that we engage in, because it's like maybe we don't care as much if the AI judges us. Maybe we will. I don't know. You know, humans always just amaze me, but I think that's kind of an interesting view
Yeah.
on it as well.
I think definitely, because it does take, when you take away, I think when you take away the idea of not having to make somebody else proud, I think a lot of mental health kind of people suffering will, like, that's a huge weight. That's a huge traumatic thing just taken away, because so many people, whether through neurodivergency, whether through continued mental health issues, have this inbuilt thing of like, I need to make this person proud. I don't need to. I can't let this person down. I can't miss an appointment because they're going to think bad of me. I can't do this because, and it's just like, no, like it's it's just AI. It doesn't. It's not. And I say that, and I know if anyone is still watching, by the way, thank you. But you know, anyone that's watching, some people will be thinking, "Oh my God, you can't do that. You've got to say thank you to AI. You've got to say please." And I'm like, I'm sorry, guys. I don't. Because, because it has, because actually for me as well, I've got irritated at AI, for instance, when it tells me, I'm very sorry that I've not answered that correctly. I'm like, no, you're fucking not. You're AI. So you're not sorry. You're pissing me off by saying you're sorry. So I think, yeah, like you say, that judgment or that worry that's in your head for somebody else may not be there for that. And you can, and again, like we said at the beginning, you can just get straight to the issue. You can get straight to it without having to muck around with everything else. And again, it comes back to, like I said, you can be that specific. Well, this is set for me. This is set for bang. That'll be able to talk to me in a certain way. It's just so much more helpful.
Yeah, and I think, you know, one of the hardest things for me is customizing things to my own preferences, because I'm not always able to articulate what those preferences are.
Mm,
Um, I think AI will help us figure out what our actual preferences are.
mm,
You know, there is a lot of discussion between kind of, you know, stated preference versus revealed preference. And I think a lot of it isn't that anybody's maliciously stating, you know, the opposite. Um, it's that we just think we behave one way when in reality, when nobody's watching, or when we think nobody's watching, we do something completely different.
yeah,
Because we never even consider how it plays into that identity that we hold. And so our answers a lot of times go into who we think we are versus who we actually are. And if you have something that can kind of tell you who you actually are, whether or not you want to hear it is a different thing. But
Yeah.
it, it is one of those like, oh, hey, I didn't realize that about myself. And the one thing I've really found is that, we are very flexible in what we can do. And the whole idea of like, neuro-linguistic programming or whatever, and kind of changing the way we think, it is possible, but you have to do it from a place of understanding where you actually are and what you're actually thinking. And it's really easy to like hide that from yourself. So you have to be very, very careful in terms of like what you're wanting to change. But when you figure out like how you behave in certain situations and how you do it, it's like you can change that behavior. Like it is totally something you can do. And I was listening to an interview where someone was kind of leading this like very party heavy lifestyle, and drinking all the time and doing whatever, just kind of recklessly, and then realized like one day that's just not who they wanted to be, and so they just flipped a switch and said, I'm not doing that anymore. Like
Yeah.
it is doable. Like you can literally flip a switch and say that's not who I am anymore,
Yeah.
but that's really hard to do for
to
most people.
you have to be careful about how we look at that. Because changing the behavior has to come after you make the mental process. Because I think when people
Right.
to change behavior without it, that's when we have trauma. That's when we have a lot of issues. When that comes down to trying to make a neurodivergent into a neurotypical. We change the behavior, like making left-handed people right-handed. And neuro-linguistic programming, of course, it is problematic because it's not real psychology. It's what happens when somebody takes Psych 101 and then becomes a salesperson, because that's literally what it's for. NLP, and this is someone that was, I've worked within mental health now for quite a while. I also was a salesperson for a decade, and it's literally completely from sales. But that there is still good in it, of course, because sales, the main thing you got to do is ask questions. Let them talk.
Right.
So what is it you're looking for? You tell me. You express to me what it is. Oh, okay. So this, that does come from it, and eking out those little things is something that's helpful and that can be used. Obviously, I'm always slightly. I want to just to kind of say to someone, careful, because I don't want someone going away and going, oh, this NLP person, this NLP master, which is what they tend to call themselves, yes, that's the person I should go and see. Because I'm like, don't.
No, that's why I was really careful to state, like, you have to know exactly where you are currently.
Yes.
And I think you have to go into a much deeper level of understanding than most people bother with.
Yeah.
But like, when I'm trying to change behaviors, and it's like, okay, you've got to look into, how does ADHD affect that? And one of the things it does is it kind of just makes things, behave according to like patterns and figure out like, where's that dopamine coming from? Because that's going to automatically affect everything that I'm doing. And so it's very difficult to change these behaviors, especially the more ingrained they are. But when you understand kind of all the factors that play into that, or at least to the level that you can, it is possible to change these behaviors. And I think all too often, most people go the opposite route and just say, oh, this is just how I am, and I don't need to bother changing because it's just who I am. And I think that's totally fine if that's truly like how you want to be. But also it's like any of these struggles that you have are also able to be overcome if you figure out how to build the systems, how to make the changes to your environment, to your life. Like it's not particularly easy.
Yeah.
And one of the things that this person who was being interviewed said, like, the first thing they did was they changed their environment because they realized that their environment, the people they were hanging out with, everybody was doing this, going out and partying and everything and not taking care of themselves. And so first thing you got to do, like, if that's not what you want to be anymore, if that's not who you want to be, you have to leave that environment. And it can be really tough to leave an unhealthy environment if it's not serving you anymore.
Absolutely. Yeah, definitely something we need to do.